Well, good morning, everyone. I hope you're having a good AMO. I certainly am. We've had an opportunity with my parliamentary assistants, Anthony Liardi and John Jordan, and of course, my Associate Minister, Vijay Thanagasalam, to, over the course of the last number of days, meet almost 80 delegations. And that opportunity to hear directly about what's happening in your communities is a very valuable resource for us as we move forward on our next stages in the Ministry of Health. Thank you as well to AMO President Robin Jones for the invitation to join you today. I know that Robin has taken on some additional responsibilities as the President of AMO, and I really appreciate her commitment to your organization. And of course, to the municipal leaders and representatives in the room and across Ontario for everything that you do every day to support healthcare in your own communities. Over the course of the AMO conference, as I said, we expect to meet almost 80 delegations, and that opportunity is really the touch point for allowing me to share with my speech today some of the things that you have been talking about in your communities. So, as we move forward, as I said, we appreciate the opportunity, and we want to take that feedback and learn from it. Under the leadership of Premier Ford, our government continues to protect and strengthen Ontario's healthcare system and make it easier for Ontarians to connect to high-quality care closer to home. Ontario continues to lead the country with nearly 90% of people connected to a primary care provider. And today, I would like to highlight the progress we've been making on that $3.4 billion primary care action plan, which is well on track to connect every Ontarian to a primary care provider by 2029. Since we launched the Primary Care Action Plan at the start of 2025, more than 400,000 people have been attached to a primary care team. Last year, our government funded 130 primary care teams under this plan, which means more people in your communities are now connected to the care they need and deserve closer to home. This includes, for example, in the north, where the Port Arthur Healthcare Centre in Thunder Bay created a new family health team, which has already attached more than 9,000 patients to primary care. Or here in Ottawa. Thank you. They must be from Thunder Bay. Or here in Ottawa, the Montfort Academic Family Health Team has attached nearly 1,500 patients. And in Bruce Grey counties, the Brockton and Area Family Health Team has attached over 3,900 additional patients to primary care. But we're not stopping there. In March of this year, we announced that an additional 124 teams are receiving funding for a new or expanded primary care team, which is expected to connect another 500,000 people to primary care across Ontario. And today, thank you. These are people in your community who are getting attached to primary care for the first time in many cases, years. And today, I am pleased to share that with you, as of September, we are launching our next call for proposal, investing over $250 million to support nearly 80 additional primary care teams. This enhancement will provide an additional 600,000 more people with access to care and bring us one step closer to connecting every Ontarian to primary care teams. This ongoing progress reflects the dedication of clinicians and teams in your communities and healthcare workers who go above and beyond every single day. I've had the opportunity, as have many of my colleagues, to visit a number of primary care clinics across Ontario, in Hamilton, Kawartha Lakes, Toronto, and I've heard firsthand from Ontarians about what this means to them and their families. Comments such as, "I'm relieved, knowing I'm going to be referred to a new doctor and I can get the care I need." And from a primary care leader that I visited in Hamilton, who stated, "The incredible stories we hear from people as they get connected within their local neighborhood are inspiring. This is life-changing work made possible by our province, our partners, and the people working within primary care. These conversations really illustrate at a very personal level how meaningful and important our work is to expand primary care for Ontario families. Our work to expand access to primary care is also supported by our ongoing efforts to grow Ontario's world-class healthcare workforce. Since 2018, our government has registered more than 100,000 new nurses and over 20,000 additional physicians, with an over 14% increase in family physicians. We've created 2 new medical schools in Brampton and in Vaughan. And through the Practice Ready Ontario program, we are streamlining requirements for internationally educated physicians so they can start practicing in Ontario faster. Beyond primary care, our government continues to make record investments in mental health to break the cycle of addiction by opening up homelessness and addiction recovery treatment hubs, or heart hubs, across Ontario that are connecting people to comprehensive treatment and recovery services, such as primary care, mental health and addictions, employment services, and of course, housing support. 2 years ago at AMO, I announced these new heart hubs, and today I'm proud to share the progress that we have already made. Thousands of client interactions have already taken place, and we are seeing the positive impacts in your communities, such as through the Somerset West Community Health Centre Heart Hub here in Ottawa, where a client who had experienced instability and challenges over many years has made significant positive changes in his life since being connected to supportive housing with a dedicated support team. As a provider at Somerset noted, stories like this are a powerful reminder that recovery is rarely linear, but when people have access to stable housing, compassionate care, and a team that continues to meet them where they are, meaningful and lasting change is possible. Or at the Simcoe County Heart Hub, we've seen over 100 people complete recovery programs and get their lives back on track. That's back with family, back with community, and in some cases, back in meaningful employment. In addition to primary care and mental health, we know how important emergency health services are to your communities. That's why I'm pleased to announce that our government is continuing to support municipalities with an over $1 billion in land ambulance funding, representing an average increase of 9% in 2025. In addition, our $33 million investment for the dedicated offload nursing program, and by fostering innovation collaboration between hospitals and emergency services through the use of the 911 models of care, we've actually seen provincial ambulance offload times decline by nearly 70% since October of 2022. This shows that our plan is working. We also continue the important work of building stronger and more sustainable public health units. Since 2018, provincial funding to public health units has increased by approximately 24%. And to continue to strengthen public health units, our government is extending the base funding increase for another year by 1%. There is no doubt that these investments are making an impact on your communities, an impact that we know, but there is no more work to be done. Under the leadership of Premier Ford and with our health and community partners, we are ensuring every single person in Ontario can be connected to world-class care where and when they need it for generations to come. Thank you again for your time, the productive conversations, and for everything you do to support community health and well-being across Ontario. Stay well.